I'm Dr. Alan Muskett from Billings Plastic Surgery, and I'm here with Tricia Kelly, who's a registered nurse who works here at Billings Plastic Surgery as well. And what we're here today is to talk to you about breast augmentation. Now, you see a lot of advertising for breast augmentation, a lot of fancy websites, but we would like to give you today kind of a real view of what breast augmentation is like, what it's for, what to expect, and really pretty much everything you need to know about it. Now, the other question that comes up with breast augmentation is, do I need a lift? What are the things that would tell us that a patient needs to have a breast lift as well as implants?
Well, that depends on the degree of what we call ptosis. That's sagging, layman's terms of droop. Sadness,
yeah,
whatever,
sadness.
Deflation.
That's right.
A couple of terms that you could use. But depending on the degree, obviously you can certainly go through changes, whether it's weight loss, you have weight gain, then have weight loss, and or pregnancies, breastfeeding, all those things play into it, where tissue's been stretched. There's varying degrees. So not everybody necessarily needs a lift with an implant. And there's measurements and things that we do and look for to decide whether or not that person is going to need a lift in conjunction with an implant at the same time.
And I think probably one of the best indicators is if you look at the position of the nipple on the breast and look at the position of the fold under the breast. If the nipple is falling down below the fold under the breast, usually a lift is indicated. But that's something we go over with you in the office. We show you pictures, we show you the incisions required. There are several different kinds of lifts depending on the needs there. But that's something that we go over during the consultation and then let you decide, whether or not that's something that's appropriate for you. Let me just describe a little bit about how the surgical procedure works. First of all, it's an outpatient procedure. You'll come to our office in the morning, see an anesthesiologist. There's an intravenous line placed. Go back to the operating room, go to sleep, and the procedure takes between 30 and 60 minutes depending on the complexity of it. And we go back to the recovery room and usually spend a couple of hours in the recovery room and then go home. You do need to have a responsible adult with you to take you home and spend the night with you. And then we'll see you the next day to check on everything and assure that you're off to a good start. We'll usually see you at that point from 2 to 4 weeks post-operatively to make sure that things are progressing well. So it's not a long operation, it's a very safe operation. I think that's an important thing. If you have children, you have family, you have responsibilities, you want to know that you're safe. We also use board-certified anesthesiologists. We use a fully accredited operating room, state-of-the-art equipment, and certainly board-certified surgeons. I think one thing that's very important when you're looking at breast augmentation, you'll look online and you'll see some prices that are lower than other prices. But it's important to realize there's differences in what you're getting, in terms of whether you're getting a fully qualified surgeon, whether or not you're getting a fully qualified anesthesiologist. And these are things that are very important to the outcome of your procedure. So the differences in prices are generally not real large, but the difference in quality can be very high. So I think that when making a decision, it's very important to realize that this is your health, this is your body, and this is a time to get the very best. I feel like our prices are very competitive, especially for the kind of product we're offering. All right, we'll look forward to seeing you at Billings Plastic Surgery.